Hi, everyone. Welcome to Concussions and Women podcast, a series hosted under the Concussion Talk podcast by founder Nick Mercer. My name is Dr. Allyssa Memmini, and it is my honor to host this critical series highlighting differences in injury management and support for women who sustain concussions. Today, I am joined by Emily McIndoe, a third-year PhD student and researcher at the University of Virginia, specializing in female athletes and concussion, with a specific focus on the menstrual cycle. In addition to her research, she serves as a clinical concussion assessor for UVA athletics, as well as teaches and mentors students within UVA's kinesiology department. Emily, welcome to Concussions and Women podcast.
Thank you for having me. I'm so happy to be here.
We're happy to have you. Before we dive into your research, I was curious how you first became interested in kinesiology. Can you tell us a little bit about your backstory?
Yeah, so I grew up as a dancer, so I was really interested in just the body in general and how we could strength train and grow in flexibility and all the different areas that I trained for in ballet. And so whenever I got to college, I had the choice of going professional in ballet or moving into more of a clinical framework. And I decided to get my bachelor's in kinesiology just to learn more in general. And that's where I got to take a class by an amazing professor named Dr. Lauder, and he was who introduced me to the brain in his class, and he also led a lab that I got to be a part of with Alzheimer's and dementia. So that really got me interested in the brain specifically within kinesiology. And then, yeah, I moved on to get my master's at the University of Arkansas, where I worked in Dr. R.J. Elbin's lab. And we got to do a lot of great work in concussions. And I got to research the effects of COVID on concussion recovery. And then, yeah, I got connected here at the University of Virginia with Dr. Jake Resch. And that's where I'm at now studying concussions and specifically the female athlete experience. So, yeah.
Awesome. Thank you so much for sharing. That's really interesting. Now, I know that when I was asking you a little bit about your background before this podcast was being recorded, you had mentioned that you worked with UVA athletics. Can you talk a little bit about your role and how you got involved with that group?
Yeah. So the University of Virginia plays a very foundational role in something called the Sports as a Laboratory Assessment Model. Dr. Jeff Barth established this model in the early or late 1980s. And this model allows for a clinician research partnership where you can work clinically with athletes as well as potentially collaborating with them to do research. So here at UVA, I get to lead our concussion protocol alongside Jake Resch, and we get to collaborate with them. And thankfully, 97% of our athletes also consent to allowing us to use their data for research purposes. And so, I'll randomly get calls to go in and do a baseline assessment or a post-injury assessment, but we also get to use that data for research, which is something we're super thankful for.
Super cool. Awesome. So you mentioned with your undergraduate degree, you had an opportunity to work in Alzheimer's dementia lab. How
Mhm.
did you get focused more on the concussion side of things?
Yeah. So something about dementia and Alzheimer's is it's more of a chronic progression.
Mhm.
And I was really interested in that, but my sister had a concussion when I was growing up. So I was also interested in what that looked like. And it's more of an acute injury. And so that is kind of how I got more interested in concussions. But also when I got to the University of Arkansas, I just really liked Dr. Elbin and wanted to work with him in whatever capacity I could because I really look up to him. And so it just kind of ended up working out that it was concussions and I had that interest. But that's how I kind of got into the world of concussion research.
Right. Well, now speaking about research, I'm very interested to learn more about the work that you're doing. I know you have a couple projects that are in progress, but would you be willing to share some of the, key samples and findings that you are developing through your dissertation work?
Yeah, absolutely. So, like I said, I'm really focused on female athletes, and one of those areas is the menstrual cycle.
Mhm.
Through previous literature, it has been shown time and time again that females experience and recover from concussions differently than males.
Mhm.
But unfortunately, there is a large gap in the literature that has explored really why that is within female athletes. And there's a lot of great people doing some amazing work right now on trying to figure out why females recover differently. And
Mhm.
one of those areas, like I said, I believe is the menstrual cycle. So the work I'm doing right now and preparing for my dissertation is looking at specific factors of the menstrual cycle and specific factors of hormonal contraception use and how that can affect concussion recovery. And one of the things that I've found that is really interesting is that the most common symptoms of the menstrual cycle are also some of the most common symptoms of concussion. So, headache, dizziness, nausea, fogginess, increased mood states. Those are things that are experienced in both the menstrual cycle and concussions. And so,
Mhm.
I'm really trying to explore how we can use that foundational information of what a female might experience to inform providers and clinicians on what their recovery might look like within concussions.
Mhm. Similarly, I'm curious, how does the menstrual cycle potentially put our female patients at risk for concussion? Is there anything in the literature or in the work that you're doing that you've been able to identify?
hmm the literature is mixed. So we know within ACL, our injury research, that there is a specific phase of the cycle that can increase your risk for potential ACL injuries.
Mhm.
Within concussion literature, there's not as much research out there. There's one study that has found that right before you start your period, and this is in naturally menstruating females,
Mhm.
that there is potentially something called the withdrawal hypothesis, which is where progesterone drops significantly. And their study found that it could increase the risk of concussions. And so that is one primary studies that has come out. But more of the research has just shown the overlap of symptoms and how that can
Mhm.
cause a lot of confusion in what is the presentation of a concussion and what is the presentation of the menstrual cycle. And what's
Mhm.
really tough, and I think one of the reasons not a lot of research has looked at this, is that the menstrual cycle is so different in everyone, and everyone's cycle within themselves is also different. And so it's really
Mhm.
hard to assess what is their quote unquote norm because there is really no normal.
Mhm.
Um, and then tie in birth control medication, relative energy deficiency, low energy availability. There's a lot of athlete specific factors that even complicate it more. So I
Mhm.
think that's why there's been not as much research done in this area, but I do think there's a lot of amazing people that are starting to dive into it, and I'm just excited to be a part of it.
Totally. Do you mind just kind of giving a broad overview of what relative energy deficiency in sport is, or REDS?
Yes. So REDS is caused from low energy availability, which is
Mhm.
caused by a variety of factors, including overexercise, decreased nutrition, as well as decreased rest. And there's a variety of different reasons that are really explained well in literature. But in
Mhm.
general, it's not getting enough energy in for the energy that you're expending out. Which can lead to REDS. And some other factors could be eating disorders as well. And so there's a lot of factors that can go into it.
Mhm.
But it is very common to see REDS, especially in elite athletes in endurance sports.
Mhm. Absolutely. I imagine with aesthetic sports, that is
Yes.
relatively prevalent, right?
Yeah.
So you talked a little bit about how the menstrual cycle could affect female patients during their recoveries. Do you suspect in your own literature search or in your own research that depending on where women are in their cycles, it could potentially prolong their recoveries?
So I have my own hypotheses that we're
Mhm.
exploring, but I haven't seen a lot of research that looks at increased recovery trajectories based on the phase of the cycle.
Mm.
However, anecdotally, if a female has increased mood states or migraines that they experience, if they were to experience a concussion around that time, I would suspect that their symptoms could be increased potentially.
Mhm.
But again, that has not been proven yet, and that's one of the things I'm going to be diving in with my dissertation.
Awesome. Looking forward to reading about it.
Yes.
What do you believe are the unique challenges our female patients or athletes may experience more than our male patients when they are recovering from their concussions?
I think there's a variety of things, but I would
Hmm.
say menstrual health is one of the primary ones. We also know in literature that females tend to report their symptoms more and have higher awareness of how they feel, which I think is
Hmm.
a really good thing, but that can also cause increased anxiety to how they're feeling. We also know in literature that females have a higher incidence of anxiety and depression, at least that is diagnosed as compared to males. So I think
Hmm.
that's another thing that could impact their recovery. But when it comes to the menstrual cycle, I think there's just so much to know and be explored in that area. And I don't know if a lot of clinicians are really asking about that in a nuanced way.
Hmm.
And that kind of ties into something that I've been working on here, which is creating a questionnaire that can help us to systematically track the menstrual cycle
Hmm.
within female athletes. And so it's called the Menstrual Cycle Questionnaire, and it's a questionnaire that we are going to start using here actually in a few weeks with our incoming athletes, where in
Right.
their baseline assessment, they will take this questionnaire. It takes about 7 minutes, and it addresses things that we wouldn't think to ask, or that I think clinicians also don't have time to ask. So,
Hmm.
menstrual history, medication use, also if they started a hormonal contraception and then switched and then got off, that causes a
Hmm.
lot of effects, as well as what they typically experience with emotional, physical, and sleep symptoms, and the timing
Hmm.
of that they believe is around their cycle. Because we can always estimate things, but truly, we are the only ones that know what is happening in our body. And
Hmm.
having a way to get a baseline of that, I think, is really important.
Hmm.
And then here we will also use it again, that questionnaire again post-injury to assess one, where they are at in their cycle, if they're
Hmm.
on a different medication of hormonal contraception now, if they just got off of hormonal contraception, and then also looking at those symptom scores
Hmm.
to really identify like, okay, this individual experiences significant headaches 2 days before her period, and she just got a concussion and she's about to start her period.
Yeah.
So let's consider that. Or also, sleep disturbances are also very common around the menstrual cycle, and sleep disturbances can also cause a lengthened concussion recovery. And so,
Hmm.
being able to inform females on how they can improve their sleep hygiene around their
Hmm.
concussion could also be helpful. So I think there's a lot of
Yeah.
tools that we can begin to implement, but I think those are ways that we can improve their experience.
Absolutely. Something similar, as you were talking, I kind of was thinking about ways in which women or even medical practitioners can track menstrual cycles. Based on the research that you're doing, how are you tracking women's menstrual cycles?
Yeah. So what we can do broadly, and there's been some
Mhm.
really good research that's come out by Christy Elliott Sale and Dr. Ella Smith, as well as Dr. Catherine Ackerman. I wrote their names down because I don't want to get it wrong. But they've given a lot of recommendations of how to study the menstrual cycle.
Okay.
Previously, we have predicted phases, and
Hmm.
unfortunately, that's not the most accurate way to go. So
Hmm.
calendar methods are helpful
Hmm.
in guiding an idea, but calendar methods or even wearables can't accurately say when you're going to ovulate or start your period or
Hmm.
end your period, but it can give information and guidance. And so the way that we're doing it in my dissertation is a combination of the calendar method, an Aura ring, as well as ovulation predictor kits.
Hmm.
But I think it's really important that we, as female researchers, recognize that truly the gold standard is going to be ultrasound, transvaginal ultrasound.
Hmm.
And that's just not feasible for my time, at least here
Hmm.
in my doctoral degree. So, something that I've read that's been recommended by these amazing women is just to identify that weakness and saying, yes,
Hmm.
we track their menstrual cycle, but we don't necessarily know for certain that they're
Hmm.
ovulating right now,
Right.
unless we have that ultrasound.
Absolutely. I think that's a great point. Thank you so much for sharing all that information. And I'm
Yeah.
hopeful that other medical practitioners that are listening to this podcast can take that information and hopefully implement that in their clinical practice, especially if they're working with primarily
Yeah,
female patients, right?
absolutely.
Great. Is there anyone in the concussion research space that you've not had the chance to collaborate with just yet, but would like to, just based on your shared interests, or maybe they have a skill set that you hope to learn
Mhm.
from and whatnot?
Um, a paper that's really guided what I'm doing and why is a paper by Jacqueline Casase in 2024. So
Hmm.
she explored with the CARE Consortium what is actually different between males and female athletes in concussion recovery. And so
Hmm.
that paper has really helped me identify that while, yes, there are differences in some ways, there are also similarities in others. And so that was an amazing paper. I think she's amazing.
Hmm.
I also really look up to Dr. Marco Patukian. She's done incredible work. She was also on that paper in
Hmm.
2024. And so I think both of them are doing some amazing work in this space. But
Hmm.
outside of concussion research, I think I mentioned Dr. Elliott Sale, Dr. Smith, and Dr. Ackerman. They're doing some really cool work as well, just within women's health and collegiate and professional athletes in general. And so
Hmm.
I think there's a growing amount of people researching women, and it's important for all of us to collaborate because I learned a lot from their methods paper on how
Yeah,
to assess the menstrual cycle. And so I think it's good to learn from people who are not just studying concussions.
absolutely. Definitely. Especially having strong female mentors, right?
Absolutely.
Mhm. What is a key takeaway that you would like clinicians or anyone else who's listening on the podcast to remember from this discussion itself or
Mhm.
from your own research?
Yeah. I think there's two parts. So,
Okay.
if someone that's listening is a clinician, my biggest takeaway would be just ask. Just
Mhm.
ask about the menstrual cycle with your female athletes. It can be as simple as tell me about your menstrual cycle, or tell me
Mhm.
about the medication that you take for your period, and how do you think it's affecting you? I think just starting that conversation is really important. And then hopefully in the future, there will be tools that can be utilized systematically, across
Mhm.
healthcare. And then for individuals listening that aren't clinicians but are curious for themselves,
Mhm.
I would just inform, especially the females listening, to be very aware of their patterns within their body. Like I said,
Definitely.
we know our body better than anybody else. And so that information can be incredibly useful, especially with the athletes I work with here. They are very aware of their cycle and they're very aware of what they
Mhm.
experience. And if they're just asked, that information can be really helpful.
Mhm.
So, yeah, for clinicians, I would say just ask. And then for people in general, I would say be really aware of what your body is experiencing and seek, medical attention if you feel like something is abnormal.
Yeah, definitely. Is there anything that has come up in your research or as you've been doing? I know you're deep in the dissertation process, so as you've been working on your literature review, that
Mhm.
has surprised you about these topics, menstrual cycles,
Mhm.
female patients with concussions, or the intersection of those two?
Yeah. My comprehensive exam study that I did last year
Hmm.
was on mechanisms of injury differences by males
Hmm.
and females. And I looked at it both within sport-related concussions, but also non-sport related concussions. And
Hmm.
I was really interested to see that there are some direct differences between males and females when it comes to both sport and non-sport related injuries. So we found that males' primary mechanism of injury is head-to-head collisions in sport, which makes sense, especially
Hmm.
because a large sample of our study and most concussion injury studies are from football athletes.
Hmm.
But we also found that females' primary mechanisms were head to ground or projectile, which is where like a ball or a stick hit you in the head.
Hmm.
So that was really interesting. That surprised me. Um, but it also brought some information of what can we do to potentially intervene in those ways,
Hmm.
especially if it comes to neck musculature, reaction time, or falls and how to fall more correctly. But what was really interesting is in non-sport related concussions, females had a slightly higher amount of motor vehicle collisions that have caused their concussion as compared to males. And males had significantly more assault related injuries as compared to females. And so I thought that was really interesting because this was specifically in a sample of collegiate athletes.
Hmm.
And it was really interesting to see those trends specifically within that population because we know a lot about non-sport related concussions within emergency room literature, but
Hmm.
that's just the general population.
Hmm.
So that really surprised me. And then one other thing that I did when I first got here our team looked at baseline differences between males and females, and we found that the only differences at baseline, at least here, were in the tandem gait. So it's a balance
Hmm.
assessment where you walk on a line, turn around, and come straight back. Females took 2 seconds longer to complete that task as compared to males. And then we also found differences in patient-reported outcome measures,
Mm-hmm.
specifically anxiety and depression. And why I think that's really important is because we have normative data that will be informing clinicians whether if an athlete doesn't have a baseline assessment. And if we
Hmm.
know that females perform differently at baseline, but we're using broad normative data, I think that can be harmful. And so I
Hmm.
think that study was really eye-opening to me about how can we as researchers really update our protocols to represent, the differences between males and females.
Absolutely. Now, before we sign off, I'm just curious, what do the next couple of years look like for you, or where do you hope to be once you are all wrapped up with your PhD process?
Yeah, I love that question. I feel like the last few years I've been really trying to think through what my dream would be and how I can really get to the next goal. So right now, I'm a third year, like you said, here at UVA. So I have about a year left, and I'm deep in the dissertation process. So I'm proposing in a few months, and then we'll be defending next year.
Great.
Ideally, I would love to do a postdoc with a women's health professional of some kind because I've said this to you before. I am so blessed to have all the experiences I have under the mentorship of Jake Resch in
Hmm.
concussions. But he's the first one to say he's not an expert in women's health, and I'm also not an expert in women's health yet. And so I'd really love to work under someone that is in a postdoc. And then
Hmm.
long-term goal would be to be a professor at a university doing a mix of research and teaching because I also really love teaching, and that's
Hmm.
something thankfully I've gotten to do quite a lot here at UVA.
Great.
So I'd love to be able to continue that in the future.
Awesome. Well, thank you so much for sharing. We're crossing all our fingers for you.
Thank
Emily, it
you.
was such a pleasure to talk with you today and to learn more about your research and your future goals for your career. I have no doubt that you will continue to be successful.
Thank you.
Thank you all for listening to the Concussions and Women's podcast. Please make sure to like and subscribe to the Concussion Talk podcast to stay up to date on the latest discussions on concussions.